So let's discuss cubital tunnel syndrome. So what cubital tunnel syndrome is it's a nerve entrapment that typically occurs somewhere in the cubital tunnel, which is just a groove where the ulnar nerve moves through the elbow. So cubital tunnel syndrome is actually the second leading cause of ulnar nerve compression or neuropathy, where you're going to get kind of numbness and tingling into the hands. Now, when we flex the elbow, we tend to kind of have that ulnar nerve kind of tractioning back and forth, as well as you're going to kind of feel some tension put on that nerve, but it should also kind of groove, kind of slide through that groove as well. So typically when someone that might kind of experience this is someone that might have their arm in flexion for a long period of time, such as holding tools or utilizing the elbow, or someone that also might be putting like their elbows on a desk. So if you kind of compress that area, or you push on that cubital tunnel area, you may get some of that compression. And that's where you're going to kind of start to see that numbness and tingling down into the arm. So typically when someone presents into our office with some form of numbness or tingling into the hands, we have to really look into this condition and kind of rule out this symptom or this condition. What we're going to be looking for when a patient comes in is numbness and tingling into the last two fingers of the hand. The numbness and tingling may actually start at the elbow, kind of where that cubital tunnel is, and it kind of moves down into the arm. Patients may also kind of experience a little bit of tenderness and discomfort when we push on the ulnar nerve that's in that cubital tunnel area. So also, we kind of have to determine if the patient is in a profession that may be kind of pushing this condition a little bit more as well. So, do they sit in kind of an elbow flex position all day? Are they working on a desk? Are they working on telephones? Something that may kind of require, the elbow to be in this bent position for a long period of time. That's going to kind of, one, compress that area, but two, it's also going to kind of stretch that ulnar nerve that we kind of have to look at. So this condition has been proven through the research and evidence responds really well to conservative care. Now, typically a condition such as this may take a little bit of time though. Typically in the range of 2 to 3 months is kind of what some of the research and evidence is pointing to for this condition. Now, typically the treatment is going to include strengthening the elbow flexion muscles as well as the extension muscles, but more so kind of in like an isometric contraction, because you don't really want to try to bend that elbow too much. You don't want to put a lot of stress on that nerve or that cubital tunnel area. We also like to do a lot of myofascial release and kind of just stretch out that area, as well as we'll improve movement of that nerve with some neurodynamics, kind of just teaching how to nerve floss that nerve a little bit, kind of get some motion in there, and that will kind of help release some of that pressure. Now, ice tends to be pretty useful for this as well, to kind of reduce some of the inflammation, as well as day to day we can incorporate some kind of bracing or some kind of elbow pad that might help kind of give you a little bit of relief from the compression. someone that might be having some kind of numbness and tingling into the hands or the last two fingers, we'd love to help. We'd love to take a look. We'd love to kind of give you, our best assessment of the condition. So feel free to give the office a call at 513-463-3011, and we will see you soon.